how to promote and implement best practice guidelines. And I'm really excited about the topic today and also our speakers that we have with us. So we have two presenters today, and it is with my pleasure that I introduce them to you. We have John V. Katari, and John V holds a BSCN from the University of Alberta, along with associate's degree in science, social science, and arts. And after attaining her license as a registered nurse, she moved to Ontario, starting her nursing career, focusing in on community practice. Initially, John V worked for home and community care support services, providing both palliative care along with wound care, continence management, and enterostomal therapy. And since 2013, she has worked as a registered nurse at Central West Specialized Developmental Services, known as CWSDS, on the various capacities, including health services and a regional dual diagnosis service. At present, she's the healthcare facilitator at Central West Network of Specialized Care for Waterloo, Wellington, and Dufferin regions, supporting people with intellectual and developmental disability, mental health, and also complex medical needs in the community. We also have Michelle. Michelle holds also a BSCN from the University of New Brunswick, Humber College Collaborative Program, and she started her nursing career working at the Milton District Hospital in emergency department. And she quickly became the triage in charge nurse in a very fast-paced and growing environment. And in 2012, she started a new path in nursing, working at Central West Specialized Developmental Services. And for 10 years, she has been the health service nurse who provided care for people with intellectual disabilities and a dual diagnosis. Recently, she has changed roles and is now the dual diagnosis community nurse specialist for the dual diagnosis program. And she provides support to people in the community with intellectual disabilities and also mental health needs. Michelle also continues to maintain her experience in the emergency department at Oakville Trafalgar Memorial Hospital. Again, it's with great pleasure that I introduce to you our presenters, John V and Michelle.
Good afternoon, everyone. Today, my colleague John V and I will be presenting on our collective strength in action and how we implemented best practice guidelines at Central West Specialized Developmental Services. My name is Michelle Catano, and I am the dual diagnosis nurse specialist for the dual diagnosis service.
Sorry, you didn't let me unmute there for a second. I am John V. Katari, and I'm the healthcare facilitator at Networks of Specialized Care.
Today, some of our presentation objectives, there's a few key objectives we hope to provide. One being the partnership between Central West Specialized Developmental Services and RNAO. Throughout the presentation, you'll hear us refer to Central West Specialized Developmental Services either as CWSDS or as Central West, just to make it a little easier. We will also provide different strategies that we use to encourage the staff at Central West to become RNAO change agents and champions. We will also discuss how we involved key stakeholders and how it was an important aspect to our initiative, and we will provide ways on how we were able to obtain this. We'll discuss different strategies that we use to implement best practice guidelines, and also how to overcome challenges and barriers during the implementation process. A little background history about Central West, just so everyone has an understanding of who we are. In 1975, Central West, since 1975, has been providing support to a wide range of community and supportive living services for people with developmental and intellectual disabilities. We do service everyone in the area, people in the areas of Halton, Peel, Dufferin, Waterloo, and Wellington. We are a non-for-profit organization, and we are funded by the Ministry of Children, Community, and Social Services. The Central West is sort of like a big umbrella. Our main building is located at 53 Bond Street in Oakville. We have many different pieces of Central West. For example, we have Halton Support Services, we have the Network of Specialized Care, we have the Dual Diagnosis Service, and we have Passport. And we also have a big piece of Central West is our supportive living. We have homes, supportive living homes on our actual main area of 53 Bond Street. And we also have supportive living homes outside, which are in the areas of Oakville, Burlington, Halton Hills, and Mississauga. Our supported living homes have direct support professionals who provide care for the people we support 24 hours a day, 7 days a week. And that is where we will be focusing most of our BPGs to start off with, just so that everyone kind of understands. Since we are the first provincial, national, and international developmental service to be a best practice spotlight organization, we hope to transfer the knowledge gained through the community homes into the developmental sector and provide it into other agencies that may benefit from what we have learned.
So as Michelle mentioned, we are focused in driving excellence in providing specialized services and care for people with developmental and intellectual disabilities with complex needs, which may include medical or behavioral needs. CWSDS is a recognized center for excellence of delivering an evidence-based integrated system of care for those with high risk of behavior needs. We do this through ensuring that we're accountable and adapting to the rapid changes to the environment and culture, our continuous collaboration with a multidisciplinary approach of care, and ensuring active participation from people we support, families, and our surrounding community. We strive to utilize innovative ways and methods to improve and enhance our services while ensuring mutual respect and trust. As we began to frame our best practice guideline journey through the BPSO work, we thoroughly reviewed the leading change toolkit provided by RNAO. And the quote that really resonated with us was, "The formation of a collective identity does not occur in isolation. Instead, it is shaped by the local context and environment in which social movement occurs. This includes an awareness of the opportunities available and the constraints." And our vision and our values, as highlighted right above in our slogan, are in alignment with RNAO's key guidelines for framing the best practice guideline. As we engaged with our key stakeholders to form a collective identity, to create a greater impact and achieve more as a team within our social and context and environment. And so today we'll be sharing some of the strategies on how we achieved that over the past, our first year in our CWSD and RNAO partnership, and hope to continue and evolve through this journey. So where did we start? Where to begin our journey? And so over the next few slides, we will be talking really about how we developed the CWSD and RNAO organizational structure and identified our key stakeholders across the organization, along with some of how we prepared for our expanded launch with our partnership with CWSDS and RNAO, and really to raise awareness and a greater understanding and the purpose of this initiative, how we engaged with our supporting professionals as our social movement evolved. So as you see towards the side there, our CWSDS RNAO organizational structure. But prior to doing that, we ensured that our BPSO journey was integrated within our strategic plan, as it really focuses on creating tools, developing partnerships, and processes utilizing evidence-based decision-making to improve health outcomes of the people we support. But as with any initiative or a project embarked, we have to educate ourselves. And therefore, BPSO Steering Committee and the Best Practice Guideline Implementation Team became RNAO champions, attended many information sharing webinars such as this, regular RNAO knowledge exchanges, and connected with our BPSO coaching calls monthly to gain knowledge, understand the methods and ways to structure and frame our next steps, and through this journey to achieve our shared goals. But in doing so, we were able to identify some of our key stakeholders who held many of the attributes for an effective champion, such as influence, physical presence, and participatory leadership skills. Our continuous collaboration and guidance from RNAO coaches and the Enquire, also, and that's the shorter way of saying it, but the longer way would be the nursing quality indicators for reporting and evaluation team. They really helped us guide and collect and further sustain the best practice guidelines. So felt comfortable, confident, and supported to begin planning for our launch.
So heading into our launch, we began our launch in September of 2021. Our launch, we extended to a week due to it having to be virtual. We would have loved to have done our launch the more traditional way where everyone would show up at 53 Bond Street and our supportive living homes would show up with the people we support as well as with the direct support professionals and have a big celebration in the gym and have treats and prizes and games. But unfortunately, due to the pandemic, we had to keep our launch virtual. So which is why we decided to extend it for about a week-long launch. In turn, we wanted to just have a nice banner at the front so that people walking into the main building could understand why we're doing this. And on the banner, we had 4 purposes. And the 4 purposes just provided everyone with the partnership that we had, always making sure that we put the person's needs, pardon me, at the center and focus on educating. Some of the purposes that we had were enhancing the quality of life. That is always our main goal for the people that we support. We always want to enhance their quality of life. Another one is developing innovative tools. We already have tools, but we are always looking to develop them a little further and make them a little better and easier to use if possible. Improving the delivery of our services. As we all know, there's always room for improvement in anything. So having something, whether it be a tool or some other aspect to try to improve our delivery of service is another purpose. And expanding and sharing information. Central West will disseminate knowledge gained, pardon me, from best practice guidelines implementation and experience with community partners across all relevant health sectors, regionally, nationally, and internationally, to promote evidence-based practices. These are our 5 best practice guidelines that we chose to focus on. We collectively as nurses from all capacities at Central West, knowing the person's need and support in all the areas, we chose to focus our initiative on these 5 best practice guidelines. The shared focus is to improve the health outcomes of the people we support. At this moment, we have just begun our journey, and we've started our journey with BPG number 2 and BPG number 3, which is person and family-centered care and preventing falls and reducing injury from falls. The reason we chose these is we felt it was very important with our population and the people that we support currently at Central West. We found a lot of them are getting older. And being on the types of medications that they're on, preventing falls was very important to us. So we found that the tools we currently had in place were working, but there was a way that we could try to avoid further falls from occurring. Whenever there's a fall, there's always, unfortunately, possibly a hospitalization or further things that happen. So trying to prevent this to begin with was a big piece that we wanted to try to work on. Also, in regards person and family-centered care, we thought it was really important to hear what the person felt from everything that goes on in their quality of life, as well as what the family thinks. So we just thought having those hand in hand to start off with was a good way to start our journey. In moving on, as our story continues, we are going to focus on BPG number 4 and BPG number 5, which is prevention of constipation in the older adult population and oral health. In knowing people with developmental disabilities or intellectual disabilities, most of them have a history of constipation. It could be just due to the medications they're on or whatnot. And also we have a huge barrier in regards to oral health. And not a lot of dentists are out there willing to support our people that we support. So these 2 pieces were pieces that we thought were really important. When someone has a history of constipation or trouble with their oral health, there's a lot of pain involved. And because most of our people that we support are nonverbal, it's very difficult to know what is causing the problem and what is it that they're in pain about. So in looking at these 2, we were hoping that in the future we could develop a tool or some sort of other means that could try to prevent this and better in their life so that they could end up with a better quality of life and we could avoid any issues with this. BPG number 1, our care transitions, is another one that we really would like to focus on later on. And that's because we want to have a plan of care to develop a seamless transition from community to home. An example of that could be someone is hospitalized for whatever reason and then is coming back to their supportive living home. We find that currently there's some barriers there and lacking in many ways of giving it a very smooth transition back to their home. We would like to develop some sort of care transition that makes things work a little bit more smoothly, so that when they do come home, everything is in place and everything that they need is ready to go, and there's no miscommunication or missing pieces. As well as if Central West decides to admit a new person to Central West in one of our supportive living homes, wherever they're coming from, we have a nice, smooth, easy transition into their new home so that everything runs smoothly. So that is the main goal as to why we chose the current 5 best practice guidelines that you see on your screen there.
Expanded launch week included a collective collaboration amongst many supporting professionals, which allowed us to talk to them about the purpose of this initiative. It also allowed us to create a bond and a collective identity with others from various departments and capacities at CWSDS. As we involved them, people became more excited and motivated to come together and begin to brainstorm creative ways on how we can further educate and execute this the launch. As you can see, we had many supporting professionals from all areas across the organization involved: managers of supportive living, direct support professionals, administrators, IT team, our finance operation, communication leads, along with many clinicians from a multidisciplinary team and our BPSO steering committee. So to begin, as a way to raise awareness, we developed an information one-page sheet. And this was really to ensure that we're providing the same information to all staff across the organization, which was shared electronically and through hard copy for all supporting professionals individually, with community partners and the families of the people we support. This information was shared nationwide as well through media press release, providing information on our collaboration with RNEO and how we plan on adopting best practice guidelines to enrich the professional knowledge and improve the quality of life. During this launch, we relaunched our Facebook page with the CWSDS and RNEO updates and our partnership. While our best practice guidelines are being implemented in our supportive living homes, we hope to share this knowledge across the organization in hopes to spark interest and understanding of RNEO and our partnership as we evolve over time. So really, to spark some momentum and interest, we developed a calendar, as you see there. Sorry, it's a bit slow here. There, it's coming. We developed a calendar so it allowed the organization to really see what's coming on a daily basis throughout the 5 days. We had a daily live prize winner draw, which was recorded and shared through communications each day across the organization with the winner's name. And the winners' names were really drawn by a variety of professionals across the organization, including our executive team, our BPSO steering committee, health services, and administrators. Our color scheme throughout the launch focused on RNEO and CWSDS logos. As you can see, the calendar color, the logos on the t-shirt and spirit wear, as well as the logos were embedded within our fun activities. We chose fun orange juice, green apples. All of those were individually packaged and delivered to each of our supportive living homes, as well as all 350 employees and 66 supported staff across the organization. For staff, we also had information sheets shared within the little giveaways. And the spirit wares were given throughout the week with the live draws. To further engage and support, we had the selfie frame kits to engage the people we support as a fun-filled activity, and as well as announcing the pumpkin carving contest.
So as you can see, we just provided some pictures of how our collective strength shone through. So there's a selfie frame there from one of our supportive living homes state. Everyone contributed, every single supportive living home contributed to the contest, and that's just one of the ones we chose to show. You can see some of our team members there just packaging all the goodie bags and getting everything ready. So everyone had a lot of fun with this launch, and with all the prizes and giveaways. I think in the end, the week-long launch was quite a success. So with the launch came a lot of questions. It provided an opportunity for different professionals in our organization to come at us and ask us a lot of questions as to what is this RNAO partnership? What is this all about? So this allowed us to involve people to become RNAO champions, involve people to become RNAO change agents, which is what we wanted. We were able to see that overall across the whole organization, there was a shared concern and understanding that this is an initiative that would bring change in an improved and enhancing way. This provided people to want to be a part of this initiative. So it also helped us to shape a team for a gap analysis and helped us to decide which stakeholders would benefit from which gap analysis. Along the journey, of course, no story is perfect. So there are some speed bumps in the road. And in coming to our speed bumps, we face a lot of challenges and we came up with some resolutions to deal with those challenges. I'll just go over a few of them. So one big one is being virtual, as I stated earlier, with our launch having to be virtual. It created a little bit of a difficulty. So, and the pandemic, of course, with staffing shortages and whatnot, we had to find different ways. So being able to connect virtually actually gave us a little bit of flexibility, because certain homes who were further away were able to connect virtually. So this actually turned out to be a benefit in many ways. We also thought that our celebration was maybe a bit too subtle and quiet, but because we gave out the treats to all the houses and we had the week-long launch and we had giveaways, we found that we were able to make the celebration a bit more fun than what we thought it was going to be in the end. Another huge assumption that we found was that everyone thought that because it's RNAO and there's RN, registered nurses, this is only for nurses, only nurses are doing this. We had to then alter our approach. We needed to look at things through a different lens. We needed to see that, no, this is for everyone who provides care for the people we support. So we had to change our terminology that we used. We had to do a few things in that nature and show everyone that this is a collective approach between everybody, and you don't have to be a nurse to do this. You provide care for them, we can all make a difference and we can all make a change. So of course, as we move on, we dealt with these and we know there will be more, but we'll continue to get through them.
So as Michelle mentioned, we really wanted to connect with people and ensure that there's a clear message across that this initiative involves all supporting professionals. So we began to attend as many meetings as it involves all supporting professionals to educate, evoke interest, address any opposing point of views, and really just connect with people's minds. And really important for us to highlight during this initiative was to offer, and supporting professionals are aware that the initiative's purpose is really not to, whereas it is really to formalize and enhance the current practices so we can ensure we're providing the best practice and we're implementing evidence-based during our day-to-day practices. We also presented at our conference to share knowledge through our community partners. So we attended the Canadian Health and Wellbeing Conference, was really with many who are also involved and provide care to those with intellectual disabilities across the lifespan. Following our successful launch development of our core leadership team, we invited key stakeholders specific to our first two best practice guideline, person and family centered care, as well as falls-related and falls-related injuries in conducting the gap analysis. And we reviewed the gap analysis in a systematic way and assessed all the guidelines and the recommendations in alignment with current policies, baseline data, and domains of accreditation. This really allowed us to engage in a dynamic dialogue and have a plan for any barriers or challenges that we may face, and collectively identify the gap that we would like to prioritize. Our subcommittees were also involved in focusing on the next steps, and CWSDS as well initiated an advisory council to collaborate with families and the people supported in interprofessionals in the community. And at the end, we really hope to really close the gap and disseminate our knowledge throughout the organization as well as with our community partners. Sorry, there's a lag here. Jamie, I'm not sure.
I'll just give it a minute. And
John V, if you just click in the middle of your screen again.
Still a lag. There we go.
So we took a moment to reflect on our journey so far. We didn't want to wait till the end of our journey. We wanted to kind of get a reflection of the direct support professionals and how they felt everything was going up until now. And majority of the direct support professionals made it sound like this was all geared towards the actual problems we face, and it's been an easygoing flow. And they all understood that at the end, it was going to be a great initiative. So we took this moment to take it with us in case we needed to think forward for the next BPGs that we're going to be implementing.
John B, if you can click in the middle of your screen and then advance the slides, it will work then.
Okay, got it. So as Michelle mentioned, this again, restrictions and regulations, but we a positive and slow down and take it one day at a time. That being said, we wanted to keep the momentum and the energy such as collecting and analyzing current data and falls for and our surveys and individual support plans.
We also wanted to make sure that we tried to reach out to different community partners that were similar to ours and try to get tools that they may have possibly used. And in utilizing the RNAO best practice guideline order sets, we were able to obtain some information from different bits and pieces to put towards our tools that we plan on using in our implementation process. We also have to make sure that we always make sure that everyone knows that RNAO is still doing work in the background, even though we're not always on the forefront. We try to keep RNAO on our agenda at every team meeting if we can. We try to attend team meetings just to let everyone know that these initiatives are continuing. We wanted to do a little spring contest just because the launch was so successful. So we provided every house with a Bristol board, white Bristol board, and just said, you know, go ahead and do a spring scene of some sort. And we just wanted to get an understanding of what people thought the Central West and RNAO partnership was all about. And as you can see by some of the entries that we have there, it appears that the supportive living homes, everyone working in there and the people that we support who were involved in making these have noticed that RNAO is going to bring some change, and there will be challenges, but along the way, it's going to be a beautiful ending. And I believe that everyone is on board with this, and that we have everyone's support, and everyone in the end is happy with what we're going to be doing.
So I know that we are a bit short in time, so I will take some questions now.
John V and Michelle, thank you so much. This was really an engaging presentation. I was just making note of a few things as you were speaking, and two things that really stood out to me was in respect to the importance of collective identity and how early on, you know, you honed in on that. But also, I really liked how you were able to rally the staff around that shared concern of patient outcomes and improving patient outcomes. I think that was really great to get the work started. So, you know, kudos to you and your team for doing such a great job. And so we do have some questions and comments also in the chat box itself. I do see here a question in respect to your banner. I think there's quite a bit of interest around your banner. And so one particular comment here says you chose to highlight your purpose or the why of what you were doing. Why was this an important strategy for you to take in terms of leading change at the organization?
So I think when we developed the banner, and that's a great question, because when we actually attended many of the RNAO knowledge exchanges, as well as the best practice clinical institute, what we learned was it is very important for us to really know why. And if we can understand and agree with the reason why, we would be more comfortable and confident in moving forward to want to more agreeable to that change. So I think it was more important for us to really highlight why we're embarking on this journey. Why is there a partnership with RNEO and CWSDS? And that's why we wanted to highlight those 4 reasons right up at the front when people walked in. Because the other reason as well was that we weren't able to be there physically always with the banner to be able to have that conversation and interact face to face, as Michelle mentioned. Brief working on this journey was very important. So I really hope that answers that question there.
Awesome. There's also a comment here saying it was really a great picture to demonstrate how we've been able to recruit champions. So it's been a strategy to help with the recruitment of champions for the work that you're doing. And also I see a comment here in respect to you know, someone has tried or had some difficulties before from previous experience. They faced some challenges around the assumptions of implementing BPGs is solely for RNs, and had some issues with, you know, just engagement of all the health professionals in the work. So they're just wondering, do you have any tips or just some key suggestions on how to promote more involvement from all health healthcare individuals in the organization?
So, I think sorry, go ahead, Michelle.
No, it's okay. I was just going to say that I think one big piece is we started joining in on the staff meetings for the supportive living homes, and just letting everyone know that it's not, we just really had to reiterate, it's not just nursing. So they're the ones there 24 hours a day. We need their eyes and ears. There's only a few of us as nurses here in Central West, so we need their help. And we just pointed out the importance of everything that they do on a day-to-day basis with the people we support, and just giving them the positivity that they deserve, and all the work that they do, and crediting them for everything. So, and because we have such a larger multidisciplinary team, we do have OTA and a PTA who are involved with us. They are so involved with falls and all the equipment that when we brought it up with them, they were completely on board, because overall that is part of their role. So just making sure everyone understands. So sometimes the language was a bit, it was very wordy. Sometimes the words that we used just weren't the proper choice of words. So when I said that one of the barriers was the terminology we used, it truthfully was. We just had to simplify everything and make things seem like that in the end, you're going to have less hospitalizations, you're going to have less this, less that, and nobody wants any of that for the people we support. So when we started showing them what the outcomes could be, I think they really understood and grasped that in the end, this isn't just nursing, this is everyone involved in this person's care. And it really in the end made a difference. But it was a lot of jumping in and going into the staff meetings and doing a lot of that, and a lot of promoting, really.
Awesome.
Sorry, Jean-V, if you have anything else to say, Jean-V.
No, I was just going to say the same thing. I absolutely agree and echo everything Michelle said. It was a lot of conversation, because everybody learns different ways. There's visual learners, there's ones who like to read, there's ones who like to listen, ones who like the informal conversation. So we really had to find various ways, some where we had to do one-on-one meetings. So that was really the only way we could really promote and encourage and really get an understanding to people the purpose of this initiative. Sorry, and I see Tara's hands up. So
Tara, go ahead.
Oh, thanks, Michelle and Jean-V, and great presentation. The only thing I was going to add, just because in developmental services, we use the slogan, nothing about us without us. So really it was important for us to include the people supported, and we really wanted people to know the why. Why are we involved in this partnership? For all the reasons that Michelle and Jean-V have already explained, but we really wanted to make sure that it wasn't just about staff and leaders across the organization, but that it was also really important for the people in the homes and the people supported to understand this initiative. So I just wanted to add that. Thank you.
Thank you, Tara.
So much, Tara. Yeah, so I also see some comments here in the chat box, just really terrific banner. They really love how you were able to highlight the initiative and the partnership between your organization and RNEO. I do see a comment, but also a question. From Tara, I would like to know what steps you took to prepare. You mentioned the Leading Change Toolkit. Did you read it in its entirety, or did you focus on certain areas? Or were the champions webinars that you went to that helped with this? Like, what was your strategy and your approach to this?
So I really do have to commend to our BPSO coaches and the entire RNEO team. There is a lot of information on the Leading Changing Toolkit. Did I read the whole thing? I don't think I was able to go through all of it, but I did begin to start framework and of course the knowledge to action. Took a while attending a lot of the BPSO coaching calls, attending information sharing webinars. I am an RNAO champion, as well as many of the, we have about 20, more than 20 at this point, members of our BPSO journey that are RNAO champions. So all of that really helped us identify where we're going to, where's our starting point. And our coaching calls really helped guide that as well. Through the steps, I feel like I'm stuck and I resources around that piece. I'm always like, the Leading Change Toolkit is like the #1 on my bookmark. Referencing it to it, it's like a guide as well as a learning point for me. Anytime I'm about to begin a new initiative or with the BPG, starting a guideline, can I think of any other ways on how to bring this tool? Are there other tools for this BPG? So that's really how I use the Leading Change Toolkit.
Excellent. And so just a lot of amazing work from Gabrielle and Cheryl sharing that, really lots of work done, very thoughtful in terms of your approach. Patty saying thank you for your presentation. You've given her much inspiration on how to move her project forward. So I think you're inspiring some minds here on the call today, which is always great to know that your presentation is able to do that and to inform. It's a community to share and for us to learn from each other. There's so much value of learning from each other. So again, Jean-V and Michelle, thank you so much for your time today in just, giving time to let us know of the work that you're doing, your approach to it, the unique approach that you're taking, your successes and challenges along the way, and, informing us on the participants here today of ways that they can also approach this within the organization itself. So very engaging discussion today. So as I prepare to wrap up our webinar for today, thank you everyone who's been on the call. A copy of today's presentation and webinar will be posted on RNAO's website. And we do ask you to fill out the evaluation survey, which you will have. And if you do have any questions for our team, you can reach out to Andrea Stubbs, who's the project lead for the Champions program, should you have any questions. And we're really appreciative of you being here with us and really engaging with us. And I just wanted to remind everyone that this program is funded by the Government of Ontario. We appreciate you being here this afternoon. We hope that you have a wonderful afternoon and a great weekend ahead. Thank you so much, everyone.
Thank you so much,
Thank you,
everyone.
everybody.
Enjoy the sun.